Kirstie Alley was being treated for colon cancer at the Moffitt Cancer Center in Tampa prior to her death. The actress died Monday at the age of 71. And when we talk about colon cancer, we tend to think it affects more men than women, but that's not true. In the U.S., the incidence of colorectal cancer is very similar between men and women. Recent studies show that 1 in 21 men and 1 in 23 women will develop colorectal cancer in their lifetimes. Joining me on the morning show, colorectal cancer surgeon Dr. Alex Crean. Good morning, Alex.
Hey, good morning, Bruce. Thanks so much for having me on.
Appreciate your time. What are the symptoms of colorectal cancer in women?
So it's a good question. Like you said, it really does affect men and women equally. There are certain symptoms we want to be concerned about, like a change in your bowel movement, unexplained abdominal pain, weight loss or weight gain that's not explained. But I think the important thing to recognize, too, is that a lot of times there are no symptoms, and that's why screening is so important.
Yeah, I want to talk about the frequency of screening in just a second. But while there aren't any symptoms that are specific to women, family and personal history do come into play.
Yeah, absolutely. So if you have family members, and it can even be a cousin or, like a more distant family member with a history of colorectal cancer or inflammatory bowel disease, even a history of polyps, or if you have a personal history of certain behaviors like smoking, drinking, or even obesity, it may merit earlier screening.
And how about if things like cramping or bloating or things you normally associate with a menstrual period last longer than usual, or if they're accompanied by alarming symptoms? Time to listen to your body?
Yeah, no, absolutely. I'm of the school of thought that it really never hurts to ask. It's worth checking in with your primary care physician, OBGYN, gastroenterologist, just for peace of mind. The worst case scenario, you get a colonoscopy and it's normal, and then you're good for 10 years or 5 years. But you don't want to ignore something that's concerning to you.
So colorectal cancer is the third most common cancer in women. And I know men are encouraged to get that colonoscopy every 10 years, starting at age 45. Women?
Yep, it's exactly the same recommendations. We want to start at age 45 if you're of average risk. So if you don't have any family history, if you don't have any high-risk health problems, and if you don't have any symptoms yourself. Obviously, if you have any of those things, it actually may be before the age of 45.
Dr. Alex Crean. Listen to your body, men and women. Appreciate your time. Have a great day.